our desire is to bring nothing but the Word of God that transforms our lives.
You can't have a testimony if you haven't had a test.
When you have the new nature of God inside of you, really your worship reflects that.
If you fail, don't let it be final, because it's not fatal.
Shalom and welcome back to this week's program, Kingdom Insight. This is Dr. Kazumba. We are looking at a very interesting topic. I like this segment. As a former soccer player, I just love it. Looking after your spiritual and your physical body. To help us with this topic today as we cover diabetes, I have a family physician, a very, very dear brother and friend to me. We had to fly him all the way from Saskatoon to come to Toronto here to just come and help us understand what we're going to be talking about. Dr. Jackson Lekota, my brother, my friend, welcome to this program.
Thank you for having me, my brother.
I know we've had lots of topics that we've covered, lots of great response, and the world is being impacted because I believe as Christians we got to understand as well that God doesn't just want us to live in the spiritual. He wants us to take care of the physical. Now, We'll be talking about diabetes mellitus. Is that how you say?
That's right.
Excellent. Now, let's right away begin by looking at the history of diabetes.
Right. So this is a very interesting topic for me, actually. As far as 1552 BC, an Egyptian doctor began explaining or talking about symptoms of this mysterious disease that they didn't know what it was. What they noted with this disease was that it made people to urinate a lot. They were just pouring out urine and they were losing weight. They had no idea what this was.
Wow.
And at that time, they used to call it the melting down of flesh into urine.
Wow.
And around the same time, 1500 BC, an Indian doctor was also dealing with the same mysterious disease that he didn't know what it was. And he too noted that these people, whenever they urinated on the ground, the insects and the ants would come and crowd on that urine.
Wow.
Because it was sweet. So they used to call it honey urine.
Wow.
So it wasn't until about 250 BC that a Greek doctor began to have a better understanding of this disease. And he came up with the term diabetes, which means to pass through.
Wow.
And as the years went on and on and on, a better understanding of diabetes mellitus was achieved, and they added the term mellitus, which means honey.
Wow.
Hence the full term diabetes mellitus, because of the history of where it came from. It was a mysterious disease that they didn't know where it came from.
Wow.
And they were just seeing all these symptoms. The people were getting thirsty, they were urinating a lot, and there was this strange thing of why the ants and the insects were always crowding around the urine or the soil where these people urinated.
Wow. Wow. This is interesting because, you find people, especially in the African countries that I go to preach to, and they have that problem. They think witches are after trying to kill them.
Oh, absolutely. In Africa, we've got all sorts of beliefs for everything. It's like Western medicine sometimes is even the last thing. People always kind of seek alternative and African solution to almost everything, even though we've got scientific proof for some of these diseases. But it's the background they have, They grew up in that kind of environment, and it's difficult to change some of them.
Wow, and these things, as you're sharing, these things can be treated, as we'll be looking at it today.
Absolutely.
Now, the definition and this scientific word epidemiology. I don't know how you say it. It's there on the screen. Can you tell us the definition
Right.
of this diabetes?
So diabetes mellitus is basically an endocrine and metabolic disorder in which the body is unable to effectively absorb glucose from the blood into the tissues where it's needed, like the muscles and the brains, resulting in persistently elevated blood glucose levels, which are not healthy.
Wow.
Now, in terms of the epidemiology, according to the WHO statistics, the World Health Organization, as of 2014, there's about 422 million people worldwide with diabetes.
Wow.
About 10% of those are type 1, about 90% are type 2. Now, between the sexes, males and females, it's almost comparable, but the men are edging the women a little bit in terms of the prevalence of diabetes.
Wow.
But in both sexes, the incidence increases and the prevalence increases sharply with age. So it's a disease that we tend to see as age progresses, especially for type 2 diabetes. Now, in terms of who's more at risk, they noted that there are some certain ethnic groups of people that seems to be more susceptible to developing diabetes.
Tell us about that. Tell us about
Like
that.
South Asians people, South Asian and Indians, they just seem to have a higher prevalence of diabetes. We don't really know exactly why. The same goes for Hispanic people as well as African American people.
Wow.
They noted that the incidence and the prevalence of this disease in these people it's a lot higher.
Is it the habits or what's going on then?
We do know definitely, especially for type 2 diabetes, that lifestyle and some of the habits that we get into do contribute to the development of diabetes. However, as to why specifically, they seem to see high numbers in South Asian people and some Hispanic people and African American people, we don't really know. It's just the observation that they made.
Now, you are watching here Kingdom Insight, and we are looking after the spiritual and the physical body. It's very important, as Dr. Jackson Lekota here, the family physician, is helping us with, understanding diabetes. He gives us the figure. I understand, Doc, those numbers you're giving us, there are Christians in those numbers. There are Christians with this disease.
No doubt. It doesn't choose.
Now, that takes us to the to my second question, my third question. Can you talk about the types and causes of diabetes mellitus?
Right. I've already pointed out we've got type 1 diabetes and we've got type 2 diabetes. There is also gestational diabetes, which is the diabetes that you develop during pregnancy, but I won't talk about that for today. I'll just focus mainly on type 1 and type 2 diabetes. Now, type 1 diabetes tends to happen a lot more in younger people, like it can happen in children, even teenagers. Type 2, as I said, it tends to develop in older generation. However, with the lifestyle that people are living and poor weight control and things like that, we see in type 2 diabetes tending to occur more and more in younger people. Now, what basically it is, or the difference between the two in that, with type 1 diabetes, what you have is that your body is supposed to produce a chemical named insulin.
Yes.
Now, insulin was actually discovered by two great Canadian doctors, Sir Frederick Benton as well as Charles Best.
Yes.
Now, this chemical, it works, I'm going to try and be as simple as I can because my target audience is general people, not doctors. So this chemical, it works as a key to open the door so that the glucose can be able to be transported from the bloodstream into the tissues where it is needed.
Wow.
So this insulin acts as a key to open that, to allow that transition from the bloodstream into the tissues.
Wow.
With type 1 diabetes, what they have noted is that these people, they just don't produce enough keys. They just don't have enough insulin. Okay? So they have noted that there's an autoimmune process where your body attacks itself, and it attacks that particular organ that is supposed to produce insulin. And as a result, these people do not have enough insulin in their bodies.
Wow.
With type 2, these people appear to have adequate amount of insulin in their body. However, so they've got enough keys, but the key isn't effective in doing its job. So there's resistance to the key. So in both cases, you end up having two people who are having elevated blood sugar levels, but one is because does not produce enough insulin or enough key to unlock the door. The other one has got enough keys or high levels or adequate amount of keys. However, the key isn't effective in working. So that is the difference between the two. So as I said, with type 1 autoimmune process, it's mainly the reason. With type 2, in terms of the causes, it's a lot more complicated than that as to why the key isn't working. Obesity is one of the main reasons that they have noticed to contribute to insulin resistance.
Wow.
But we know for type 2 diabetes that genetic factors are very important. So family history. Again, lifestyle, as we've already mentioned. So lack of exercise, sedentary lifestyle, not eating properly. So all these things have contributed to the development of diabetes. Wow. But genetic factors is the biggest one. Obesity and weight control. But of even more interest that I've recently found is that they found that the quality and the quantity of sleep that you get. So they noted that people who are getting 6 hours or less of sleep tend to have a higher rate of developing type 2 diabetes.
Wow.
But even more interesting, also in their study they found that people who are sleeping a lot more, like greater than 9 hours. Whether because the less than 6 hours stresses your body and the more than 9 hours perhaps results in weight gain, we don't know.
Wow.
Dietary factors are very important as well. They have identified that people who've got low levels of vitamin D and vitamin C in their bodies tend to have to develop type 2 diabetes as well. Because vitamin C and other vitamins like E or zinc or selenium, these are powerful antioxidants in your body. So dietary factors, so people need to watch what they eat. So I found that very interesting as well. So these are some. So type 2 diabetes isn't as straightforward as type 1. It's a multifactorial thing, but genetic factors, lifestyle being the biggest one. But I must say that sleep patterns as well as dietary factors are coming into the picture, and I think that's very interesting.
You know, this is really blessing my heart, and I know it's blessing the hearts of many Christians. For those who don't know, Dr. Jackson Lekota is not just a medical doctor, he's a Christian, a born-again Christian, very powerful. He can even pray for you when you go to his office. One time we were going to Africa on a mission trip. I went right there to him because it's important for us to take care of our spiritual body and our physical body. Now we're going to continue here because I don't want to take much time of this. This is powerful. This is good. Doc, tell us the diagnosing and monitoring diabetes.
Right. Now, I think this is the most important part of the topic, because what I want our people to take from here is to be able to identify the symptoms of diabetes and be able to pick them up and go see your doctor. So diagnosis can be made based on the symptoms, and then it can be confirmed with tests. Now, the common symptoms that we see with diabetes mellitus, it's frequent urination. You remember in the history that this was what was baffling these doctors back in the days, as they didn't know what was going on, and these people were just peeing all the time. So frequent urination, as well as thirst and drinking a lot because you're urinating a lot.
A lot, yeah.
So if you're experiencing any of that, you might want to check with your physician and make sure that you're not having diabetes. If you're experiencing any blurriness in your vision, if you are constantly tired and fatigued, if you're having an unexplained weight loss, all these could be the symptoms of diabetes. Some people present even with like numbness and loss of sensation and feeling in their feet and in their toes, and already that means your nerves are already damaged if you are at that point. Now, if you have any of these symptoms, you're thirsty, drinking a lot, urinating a lot, just constantly tired, don't just sit there. Go and see your family physician. They can be able to do tests to confirm this. Now, it's a simple blood test that we do. I won't go into the details about that, but basically, if you have been fasting for 8 hours, your blood sugar should not be more than 5.6 millimoles per liter. That is the normal.
Yeah.
Okay, if it's a way higher than that, you could be very well having diabetes for sure. Some people are not normal, they don't have normal levels, but they are not, or they have not yet reached the diabetes stage, so they are in between what we call the impaired fasting glucose as well as impaired glucose tolerance. But family doctors can discuss all that in details with the patients.
Wow. Now, here, point number 5, management of diabetes. How can we manage diabetes? You've actually elaborated a little bit. Can you just share a little bit more? Because somebody say, okay, now I got this. How do I manage this?
Right. Now, management obviously has to start with monitoring. You have to know where you are to be able to know what you need to do. So monitoring diabetes requires frequent checks of your blood sugar. It involves pricking yourself, get a little bit amount of blood, put it in your glucometer, and you know where you are. You need to do that throughout the day because that guides you in terms of what your glucose is and how you need to be eating. Okay, and then I have to say this, that there are advances in terms of how monitoring can be done for glucose. Mainly right now, almost everyone is still just pricking themselves and checking their glucose levels, but they are coming up with new devices that you can just wear on your wrist, and it's supposed to detect the amount of glucose in your blood. They even have like diabetic service dogs.
Wow.
These dogs have been trained, like thoroughly trained, and they are able to alert you when your glucose is too low or too high.
Wow.
Okay? Now, in terms of management, for both type 1 and type 2 diabetes, diet is very important. You have to watch what you eat. Those calories and those carbohydrates, you have to watch what you eat. And I have to say that, especially people back home, everybody seems to know that fizzy drinks are bad for you, but there seems to be this belief that a juice, 100% juice, is supposed to be good for you.
No.
If you're dealing with diabetes and you wanting to lose weight, both of them are bad for you.
Yes.
Because 250 ml of 100% juice, some of them that just contain as much calories, like 130, 140 calories per 250 ml, almost comparable to 250 ml of all these other fizzy drinks that we know of. So diet is very important.
Yes.
Now, for type 1 specifically, as we mentioned, that the problem is that you're lacking the key, right? You're lacking the insulin. So all that needs to be done is to give you the key, is to give you the insulin. So hence you see these people injecting themselves with insulin. That's pretty much as you can do in terms of treatment for type 1, coupled with diet control. Type 2, because it has got a lot of risk factors, because it has got a lot of other components to it. So weight reduction. Exercise. We mentioned in our topic about blood pressure control that 150 minutes per week of aerobic exercise is what is needed. Okay, so lose the weight exercise, the lifestyle changes. You can't do much about your genetics. You can't change that in your ethnic groups. Now, dietary factors that I mentioned about. Make sure you consume foods that have adequate vitamin C, vitamin E, zinc, selenium. You can get your vitamin D levels checked with your doctors, and you can take supplements for those. Make sure you get adequate sleep. As we saw, that sleep deprivation, it's a problem in the management. If these are all the lifestyle changes that we can do for the management of type 2 diabetes. If we are not achieving control with all of that, there's medication, different classes and groups of drugs that can be used that I won't go into details about, but basically, and combination medication as well that can be used for the treatment of type 2 diabetes mellitus. However, I must say that they have also identified that even with type 2 diabetes, there is relative deficiency of insulin, of the key as well. Hence, we do use insulin also in type 2 diabetes. Usually, when the lifestyle modification and the oral medications have not succeeded in controlling diabetes, we go into the use of insulin as well for type 2.
That is a lot of information, powerful information, and obviously you'll be asking yourself why this topic as a Christian. In closing, I will let you know why this is important. Now, we got 7 minutes, and we have 2 points that we need to tackle. Number 1, let's go to it. Number 6 is complications of diabetes.
Right. So you can imagine your blood flows everywhere, your whole body. You can imagine having blood that is full of high sugar, glucose, flowing to every part of your body. It is damaging your organs, it's damaging your blood vessels, it's damaging your nerves. So we're talking going from toes to the head, we're talking numbness, loss of sensation, injuries that you don't feel or detect in your feet, infections, lots of infections. Can end up losing your toes or your feet or your leg as a result of that. Coming up, especially for men, erectile dysfunction. Diabetes damages the nerves, so we see a lot of men struggling in this department, and a lot of men are scared to come out and speak about it. It's a very important big subject as well, erectile dysfunction. Diabetes is a huge problem in this department. Coming up to your heart, risk factors. Diabetes is one of the major risk factors for cardiovascular problems such as heart attack. Okay, and then damages to your vessels in your eyes can lead to blindness. Okay, risks for strokes. In fact, I have to say this, that they found that people with diabetes are 3 times more likely to suffer a cardiovascular event like a heart attack. They are 12 times more likely to be admitted with end-stage renal or kidney disease. They are up to 20 times more likely to suffer a non-traumatic limb amputation compared to the general population. That's how serious it is. So people out there, they got to take the management and the control of diabetes very, very seriously.
Wow. And then before we go to the take-home message, the doc here is going to give us the take-home message, what we need to do. But I want you to understand something. I know you are talking about, obviously asking why we've got Jesus is our healer. We Christian, we've been taught by faith. We just believe by faith we are healed. If you look at first Luke was a medical doctor. God has given us the doctors to be able to help us look after the physical body. And he has given you a pastor like myself to look after your spiritual well-being. So it's a combination of the two. Absolutely. For you to be strong, I'm going to give you the word to be strong in your faith, and it results to be strong in your physical body as you look after your physical body. Now, Doc, right now, can you look in the camera, your camera there, and tell the people worldwide who are watching this program the take-home message they have to take from this program?
Okay. If there's any one thing that I want you to take from this program today, is that diabetes is very common. The complications are very serious. What you need to be aware of at home is the symptoms of diabetes that you've already mentioned. The symptoms, be aware of that, and if you're suffering from any one of them, feel free to go and see your doctor. The complications can be very serious, but it is not a hopeless situation. Diabetes can be controlled. People can live well with diabetes. So there's no reason to panic, but you will not be doing yourself any justice if you've got any symptoms at home and you just choose to ignore them or just choose to pray or have faith that God will heal you. Take care of yourself spiritually and physically. Get out there, seek help. There is help. Diabetes can be treated and people can live healthy lives with diabetes.
People can live healthy lives with diabetes. Listen, I come from a sports background, and that I understand, Doc, the importance of looking after the physical body.
Right.
I don't want to be, I don't want to fail to do what God has called me to do because I have failed my body.
Because your body is failing.
Because
right.
if you fail your body, it's going to fail you.
Absolutely. You won't be able to do your spiritual work if you're not physically right.
Now, many people think that going to a doctor is a sin. I want you today to change your mind as we begin to cross this program. Doc, one word. Going to see a doctor is not a sign of weakness in your faith.
Or faithlessness. Absolutely no.
You are a man of faith.
Absolutely.
You believe in the power of God.
I do.
You believe in the supernatural power of healing.
More than ever.
And God has given us the ability to believe the doctors, what He has revealed to you guys, so that we can stay healthy. Isn't that true?
Medicine is God's invention.
Amen. Medicine is God's invention. That was Dr. Jackson Lekota, my best friend, my brother. And, the reason I bring him on the program, this is a man of God. And he knows what he has seen in the hospital. He doesn't only treat the world, the people in the world. He's treating Christians. Sometimes we Christians are a little bit careless. We don't want to look after our own selves. We eat everything to put pressure. I call it to overwork our angels so that they can heal us. And yet God has given us the wisdom and the ability to look after ourselves. I want you to understand this. God wants to heal your physical body. And right now I just pray in the name of Jesus, whatever sickness, whatever disease you're going through, we declare healing right now. We declare supernatural healing right now. Amen. In Jesus' name. Now get up, go see a medical doctor so that you know exactly what is going on, so that we can believe with you for the power of healing to heal you. Shalom, shalom. May the Lord bless you for watching this program. Goodbye.
You have been watching Kingdom Insight with Dr. Kazumba Charles. My prayer and hope for you today is that you have grasped everything that you can from the speakers that have poured into your life today. I want to promote Dr. Kazumba Charles' new book. It's called Discovering the Power of God in You. He is an amazing man with an amazing spiritual insight into the power of God. I pray that you pick up this book and that it impacts your life. Thank you for watching.